Hi, everyone. I'm Holly Teagle, and I'm the clinical director at the Hearing House. We have prepared a video for you to share information about CMV and the clinic that you and your child will be attending soon, and to give you some background information and some idea about what the day will look like. So I prepared a short video here. So here you can see the Hearing House, and the word cloud that appears here was compiled from the first CMV workshop and clinic that we did in 2019. And parents who attended volunteered different words that came to mind when we talked about and thought about CMV and created this word cloud. And it's become sort of our logo for the clinic. The CMV Specialty Clinic at the Hearing House would not have been possible without the generous support of the Freemasons Foundation. They supported our pilot program and are also supporting us in our 2020 program. So the reason that we have put this clinic together was because we realized that we had a number of children at the Hearing House who had hearing loss as a result of CMV infection, and who also had some other special needs that we weren't able to address within our own Hearing House team. So in recognition of all those children and their special needs, we put together a team of professionals from the community who can help meet all those needs. And they include a developmental pediatrician, an educational psychologist, and occupational therapist. And so we've been working with them as well as the members of the Hearing House team, the audiologist and speech language pathologist, to put on these clinics. And the idea is that we can do an interdisciplinary team evaluation and share with families and whānau information about their child's diagnosis and some potential treatment or intervention options, and really listen to each family and collaborate with them and the caregivers to develop a plan for intervention for each child. We hope to develop a mutual understanding among parents and the health providers, and also to network among parents who come to the clinic so that they can share resources and offer one another support. The idea is that recommendations that could be put into practice in the local community could be developed. And we also hope that this would help advocate for families with children with CMV by sharing information with their pediatrician or their therapist that live locally. So the team that we've put together is shown here. So this is Rule Hamill and Lucy Charles, and they are occupational therapists. This is Rosie Marks. Many of you may know her. She's a developmental pediatrician from Auckland who's been around for some time and has seen many children over the years. This is Sandra Smith. Sandra has a long history of being involved with working with children who have hearing loss, and has been a teacher in the past and is now an educational psychologist. And this is me. I am an audiologist. And this is the rest of the audiology team, the pediatric team at the Hearing House: Diane Rafter, Robin Moriarty, and Denise Voss. And many of you know Megan Levi, who is our coordinator and has been doing a fantastic job with communications for the clinic. This is Bianca Jackson. She's a speech language pathologist from the University of Auckland who has some specialty knowledge in sensory integration. And she'll be working with our habilitation team: Victoria Holgate, Amy Waite, Aishu Suresh Kumar, and Erin Henley. They are our listening and spoken language specialists, and Bianca will be working with them to provide the diagnostic and therapy recommendations. So a little bit of background about CMV, or some common information. CMV is a virus, and it is the most common cause of non-genetic congenital hearing loss, which means that when children are born with hearing loss, and it's not due to family tree to genetics and the family history, but is due to an infection. CMV is often the culprit. It's a herpes family virus, and so it's very easily spread by bodily fluids, and that can include things like saliva and urine, breast milk, tears, and it is quite common. It's quite rampant actually in the community, but it's really only dangerous for babies when they are infected during their mother's pregnancy. And about 90% of babies who are born with an infection really have no symptoms at birth. They show no clinical signs of having had the virus. So it's sometimes a surprise for families when hearing loss is diagnosed and there's no known cause for it. And if you do a little bit more assessment, you'll find that it may have been related to CMV infection. The National CMV Foundation is a really wonderful organization that has a wealth of information for families. And that's where some of the information here I'm sharing came from. So as I said, a CMV infection is most deadly or dangerous when it's when a mother experiences it during pregnancy. And 1 out of 3 pregnant women who become infected with the CMV virus will actually pass it on to their children. So it makes the incidence of CMV quite common. 1 in every 200 children are born with a CMV infection each year. And that means that 1 child is permanently disabled by congenital CMV every hour. So while it's not uncommon, there are still a lot of people, even in the medical profession, who aren't very familiar with CMV. And so in part, that's what one of the missions of this clinic is, to help share and spread knowledge about it. So hearing loss is a very common result of a CMV infection when a child is infected during pregnancy. Most of the children who are asymptomatic will not have hearing loss, but 10 to 15% do. And of those who are symptomatic, the ones that we know have the virus or are sick babies at birth, 75% of them usually have hearing loss. And hearing loss can look quite different. It can be both ears or it can be just 1 ear. It's typically sensory neural, which means that it's permanent, but it could be a mild or a moderate or a profound degree, so that can vary. It can be present at birth, and so these children may not pass their newborn hearing screening, or it could gradually, progressively occur and not show up until a child is a little bit older. So this progressive and fluctuating nature of hearing loss is not uncommon with CMV. The only way that we can tell that that hearing loss is a result of CMV is if a child has a heel stick, or the Guthrie card, which is the little blood stick that they do on the baby's heel at birth. If they analyze that blood and the virus is present, then we know that it's a congenital CMV infection. But because the virus can spread quickly in other ways, if a child is not, if the child goes home and is exposed to the virus, they can often show that the virus is in their system, but it may not be a congenital infection. It may not have been present when the baby was born. And in those cases, it typically is not as impactful on the baby's development. So we know that hearing aids work very well for children, and cochlear implants work very well for children with CMV, but the issue is that they often have other needs in addition to hearing loss. And they can include things such as a developmental disorder, which can be a neurologic. So this is the virus likes to live in the brain and brain tissues. And so it can cause neurologic issues, so neuromotor issues, so cognitive delays, vision loss, seizures, those kinds of things. And again, just like hearing loss, there's a range of impact, and it's difficult to predict for any child what the range, what the impact of the infection will be on a child. But children with CMV often do have other multiple medical diagnoses in addition to hearing loss. And their symptoms can be things such as migraines, respiratory problems, general developmental delays, cognitive delays, movement difficulties, balance issues, visual issues, and things like autism spectrum disorder, so sensory integration concerns, attention deficit. And very often, a child will have 2 or more of these diagnoses in addition to hearing loss. So medical treatment for CMV is quite limited. There is no vaccine for CMV, but many experts believe that there will be one possible in the next 10 to 20 years. But that won't happen unless there is really a lot of increased awareness and advocacy for developing a vaccine for CMV. There is some research that suggests there are some antiviral drugs. They're called ganciclovir or valganciclovir. And those can be given to babies at birth who are symptomatic, but they may prevent or lessen the severity of hearing loss, but they also have serious side effects. And so they're not really generally used in this population. So because of the limited medical treatment, most children end up needing special intervention. And intervention can include support from a variety of medical or therapy specialists. So, and that is what the purpose of our CMV clinic is about. We wanted to use an interdisciplinary team approach to diagnose and offer treatment options. Families have reported that they enjoy having a multidisciplinary team to collaborate because it makes the evaluations more meaningful, and that sharing of information means that it makes it less difficult for the family because they don't have to repeat the same information over and over or cross-check with another medical specialist when they get information from one person and try to share it with the other. So families tend to really like having a multi or interdisciplinary team. And the purpose is we really want to look at the whole child in one setting. So the opportunity that we have with this grant from the Freemasons is to work together. And we want to create a safe and friendly environment for parents and family members of children with CMV to meet and to network. We want to support parents and their family so that they can learn and understand what a child's special needs are, and translate the findings of the evaluations that we do and make recommendations for care in the local community. The end goal is to empower parents and family to advocate for their child. So the day of the clinic will look something like this. We've asked that you bring a support person from your community. That can be either your advisor of the deaf, AODC, or your teacher. We would ask that you just bring one person, and that may be in addition to some other family members. And what we'll do, each child and family will be guided through some evaluations that will take about half of the day. And they will be guided by the support of a Hearing House team member that you already know. The developmental pediatrician, Rosie Marks, will discuss general health concerns of your child, and she may be contacting you ahead of the clinic to get more information. Arul and Lucy, the occupational therapist, will assess your child's physical strength and coordination and some of their functional skills like writing and playing and eating. Sandra, the educational psychologist, will discuss your child's ways of learning and socializing with other children. And the speech pathologist from our team will have done or will do some assessments of speech and language, receptive and expressive abilities. The audiologist will be checking your child's hearing and hearing devices. And some of these evaluations from our hearing house team members will have taken place before the day of the clinic. So the team will conduct their evaluations and interviews with the families and talk together, and then we will share all the information with each family privately, with or without the child, depending on your choice. And we'll review the findings, answer questions, and make some recommendations. And then you'll have the opportunity to share lunch and stories and with other families, and hopefully create some new friendships. So we look forward to seeing you. One of the most important things this is a slide from Rosie Marks that she lent to me. One of the most important things that you can do is look after yourself first, and let us help you understand what your child's special needs are. Every child is different. Even children from the same family develop differently. Has a lot to do with personality, has a lot to do with our previous experience, genetic background, what's happening at the time. But knowledge is power, and our goal is to empower you as a family in the best ways to help your child. Here are some very useful resources that Rosie Marks has provided that you can look up at your leisure. And we look forward to seeing you very soon. If you have any questions, please contact us at the Hearing House, and we'll be scheduling, sending you more details about the time to arrive, and you'll let us know who you'll be bringing with you. So we'll see you very soon.